Coming to our next chapter, nutrition. So, nutrition. What is nutrition? Nutrition can be defined as the science which deals with the utilization of nutrients and foods. So, that is called as nutrition. So, it is concerned with the science concerned with the foods and nutrients, and their utilization in the body is called as nutrition. And the energy content of the foods is measured by calorific value. So what is calorific value? So calorie is defined as the amount of heat required to rise the temperature of 1 gram of water by 1 degree centigrade is called as the calorific value. So that is 1 calorie. So it is measured actually in the kilocalories. So 1 kilocalorie is equal to 1000 calories. So energy content of the food is measured in the form of kilocalories. So what is calorie? Calorie is the energy required to rise the temperature of 1 gram of water by 1 degree centigrade. Right? So the energy content of approximate principles like carbohydrates, fats and proteins is, so when you take the calorific value of carbohydrates, it is 4 kilocalories per gram, and when you take fats, it is 9 kilocalories per gram, and proteins also have 4 kilocalories per gram. So that is the calorific value of carbohydrates, fats and proteins. And alcohol also has a calorific value of 7. And what is respiratory quotient? So another term we should know in case of nutrition is RQ value, or respiratory quotient. Respiratory quotient is calculated by the formula called as ratio of carbon dioxide to the volume of oxygen utilized. So ratio of volume of carbon dioxide produced to the ratio of volume of oxygen utilized is called as, that gives the RQ value or respiratory quotient. So respiratory quotient for carbohydrates is 1, and for fats is 0.7, proteins is 0.8, and for mixed diet it is 0.8. So that's about the RQ value of carbohydrates, fats, proteins and mixed diet. So it is basically calculated by using a formula, that is volume of carbon dioxide produced by the volume of oxygen utilized. And coming to, so when you are calculating the calories for a particular person, so we have to consider the basal metabolic rate. So what is BMR? So BMR can be defined as the amount of energy required to maintain life at complete physical and mental rest in post-absorptive state is called as the basal metabolic rate. So that person should be in mental and physical rest, and it should be in the post-absorptive state. It should be in fasting condition. So there should not be any dietitian. So it should be in the fasting condition. So in those conditions, the body requires energy to maintain the function of vital functions, like for the function of heart and the kidney, for the renal function, for the conduction of nerve impulses. So in all those functions, vital functions, respiration, they require energy. So the energy required for those vital functions when a person is in mental and physical rest, and it should be in post-absorptive condition, is called as the basal metabolic rate. And its normal value is, when you take in case of man, it is 35 to 38 kilocalories per square meter of the body surface area per hour, and in case of females it is slightly lower than the males. So in case of women, it is 32 to 35 kilocalories per square meter of the body surface area per hour. So these are the normal values for BMR in case of men and women. And this BMR is measured by two methods, the closed circuit method and open circuit method. And the closed circuit method is Benedict's-Roth method, and closed circuit method is, the open circuit method is Douglas-Bag method. So we have two methods by which this basal metabolic rate, BMR, can be calculated. So in Benedict-Roth method, actually we are considering the volume of oxygen consumed by that particular person for over a period of 2 to 6 minutes. So that is the basis for the calculation of BMR by using the Benedict-Roth method. And this is very important. What are the factors which influence the BMR? So there are various factors which affect the BMR. So those are the surface area. Whenever the surface area increases, BMR also increases. So that is the effect of surface area. And the second factor is sex. So in case of males, the BMR is more when compared to females because of the lean muscle mass present in the lean muscle mass, which is more in muscle in man. So that's why males have more BMR when compared to females. And in case of age, so the BMR also is affected by the age. In case of children, BMR is more, and as age advances, and in elderly persons, the BMR is low. Right? So BMR is high in case of children when compared to adults and elderly persons. And coming to the another factor, physical activity. So those who are involved in the heavy works, their BMR is more when compared to the persons involved in the sedentary life, sedentary work. So that is the effect of when the physical activity increases, BMR also increases. Coming to hormones, so hormones also influence the BMR. So thyroid hormones, in hyperthyroidism, the BMR also increases. Basal metabolic rate is increased by hyperthyroidism. And environment, in cold climates, BMR is more when compared to the hot climates. So that is the effect of environment on the BMR. And the another factor which influences BMR is starvation. So in case of starvation conditions, there is decreased rate of BMR. And fever. So in case of fever, so whenever there is 1 degree rise in temperature, body temperature, the BMR increases by a ratio of 11%. So for every degree rise, 1 degree rise in body temperature, 11% of BMR is increased. So that is the effect of fever on BMR. And coming to another disease states, in other disease states, BMR is decreased. So these are the factors which influence the BMR. Coming to another factor we have to consider when you are calculating the calories for a particular person. So that is specific dynamic action. What is specific dynamic action? In short, we call it as SDA. So the extra amount of heat produced over and above the calculated value of heat should be produced by the food when a given food is metabolized is called as the specific dynamic action. So what is specific dynamic action? So that is the extra heat produced by the food over and above the calculated value is called as the SDA. Right? So specific dynamic action for the proteins is 30%, and for fats it is 15%, and in case of carbohydrates it is 5%. So when you take mixed diet, it accounts for the 10%. Alright, so we have to provide the additional calories for the digestion and absorption of those macronutrients. In case of proteins, that is 30%, and fats it is 15%, carbohydrates it is 5%. Now coming to physical activity, so when you are calculating calories, we have to consider basal metabolic rate, we have to consider specific dynamic action. In addition to that, we have to consider the physical activity of a person. So the physical activity can be classified into 3 types: heavy work, moderate work, and sedentary work. So for a person who is leading a sedentary work, so that BMR should be, and when you are calculating calories, so that here we have to consider, in addition to BMR, we have to calculate, we have to take in 30% of BMR into account. And when you are calculating for the moderate work, here the BMR plus we have to consider 40% of the BMR, and when you are calculating calories for the person leading the heavy work, then here it is BMR plus 50% of the BMR. So this is how we are calculating the calorie requirement for a particular person by considering the basal metabolic rate, by considering the specific dynamic action and the physical activity. Right. Now coming to the nutritional importance of carbohydrates, in that we have to discuss about the dietary fiber. So these dietary fibers cannot be digested by our body. So we can define the dietary fiber as the unavailable or indigestible carbohydrates are called as the fibers. So these cannot be digested by our body because there are no enzymes which can digest those carbohydrates. So that's why these are unavailable or indigestible carbohydrates in the diet are called as the dietary fiber. So examples for the dietary fiber are, so cellulose, hemicellulose, pectin, lignin. So all of them are the dietary fibers. So what is the significance of dietary fiber? So these dietary fibers, they prevent the constipation, they increase the bowel motility, right? They increase the peristaltic movements, and they prevent the colon cancer, and they are involved in, they reduce the cholesterol level in the blood, and they also involved in the glucose tolerance. So increase the glucose tolerance. So that is the significance of fiber in the diet, right? And what is the daily requirement? How much amount of dietary fiber is required? So the dietary requirement is 30 grams per day, and the sources for the dietary fiber are mainly green leafy vegetables. And coming to nutritional importance of lipids. So lipids, they act as the storage form of energy. So they account for the 15% of energy supplied by the lipids or fats in the body. And the lipids, fats are two types: visible fats and invisible fats. So the fats which are present in the butter, ghee, oils, those are called as the invisible fats. Those are called as visible fats, and invisible fats, those are present in the eggs, fish, and meats, nuts. So those are called as invisible fats. So fats are of two types: visible fats and invisible fats. And the daily requirement for the visible fats is 20 grams per day. So that's about the nutritional importance of lipids. So in that, we have to discuss about the essential fatty acids. So there are some fatty acids which cannot be synthesized in our body, and those should be supplied in the diet. So they are very important functions in the body, and those fatty acids, we call them as essential fatty acids. And those are linoleic acid, linolenic acid, and arachidonic acid are called as the essential fatty acids. All these fatty acids are the polyunsaturated fatty acids. They have more than one double bond in their structure, so that's why we call them as polyunsaturated fatty acids. And these are very nutritionally important because they cannot be synthesized in our body. So these essential fatty acids are involved in very important functions, like they prevent the fatty liver. They are required in the synthesis of phospholipids. They are the important components of the plasma membrane, and these essential fatty acids are also required for the synthesis of prostaglandins, prostacyclins. So those eicosanoids, their synthesis occurs from these essential fatty acids. So that's why they have nutritional importance. Coming to nutritional importance of proteins. So proteins also supply energy, and that accounts for 10 to 15% of the total energy supplied. That is supplied by the proteins. So the only source for the essential amino acids is we have to take them in the diet, proteins. So when you take the complete proteins like albumin and casein, they have all the required essential amino acids, because these amino acids, they cannot be synthesized in our body. So they should be supplied through the diet, and the source for those essential amino acids is proteins. So the source for the essential amino acids is proteins, dietary proteins. So what is the protein requirement per day? So protein requirement per day is we require 1 gram per kg body weight per day. So that is how we have to calculate the protein requirement per day. So limiting amino acids. So we discussed that proteins are the sources for the essential amino acids. So there are some proteins which lack essential amino acids. So when those proteins lack the essential amino acids, those amino acids which are deficient in the particular protein, we call them as limiting amino acids. That particular amino acid, when it is absent in that particular protein, we call it as limiting amino acids. So when you take pulses, they lack methionine, and when you take cereals, they lack lysine. And this deficiency is overcome by mixed diet. So when you take pulses and cereals, then rice and dal combination is nothing but you are overcoming the deficiency of essential amino acid, whichever is deficiency in pulses is present in the cereals, and whatever limiting amino acids in cereals is there, that is present in the pulses. So that is about the limiting amino acids. Right. Coming to protein energy malnutrition. So whenever there is deficiency of calories and protein, it leads to a condition called as protein energy malnutrition. If it is calorie deficiency, we call it as marasmus. So primary deficiency is calories, we call it as marasmus. And if it is protein and calorie deficiency, we call it as kwashiorkor. So when the primary deficiency is calories, it is marasmus, and when the primary deficiency is proteins, we call it as kwashiorkor. So we have two types of protein energy malnutritions, marasmus and kwashiorkor. So what are the biochemical findings in case of these protein energy malnutritions? So there is hypokalemia, hypomagnesemia, and apart from that there is decreased protein levels in the blood, that is hypoalbuminemia. So there is decreased albumin in the blood, hypoalbuminemia, and that is less than the normal range, that is it will be in the range of 2 to 3 grams per deciliter in case of marasmus, but it is less than 2 grams per deciliter in case of kwashiorkor. So those are the biochemical findings, biochemical changes in the protein energy malnutritions. So what is the treatment for these protein energy malnutritions? So we have to provide 100 to 200 kilocalories per the kg body weight, and apart from that we have to provide 3 grams of the protein per kg body weight per day. So that is the 3 grams of protein per kg body weight per day is required in the treatment of these protein energy malnutrients. So by giving 200 to 200 kilocalories per kg body weight and 3 grams of protein per kg body weight, we can overcome this protein deficiency and calorie deficiency. And what is obesity? So whenever there is deficiency of calories, it leads to, and deficiency of calories and protein leads to protein energy malnutrition. But whenever a person takes excess amount of fat, that leads to accumulation of fat in the body, and that condition, clinical conditional nutritional disorder, is called as obesity. So obesity is characterized by the excess deposition of fat in the body. So whenever the excess amount of fat is deposited in the body, it leads to increased number of adipocytes and increased size of the adipocytes. So there is increased number of adipocytes and increased size of adipocytes in case of obesity. And whether a person is obese or not, you can calculate by using a formula, that is body mass index can be calculated by using a formula called as weight by height square, and weight in kgs and height in meters. Weight by height square gives the body mass index, and the normal body mass index is, it should be 25 or less than 25, and when it is in between 25, in the range of 25 to 29.9, we call it as stage 1 obesity, and it is stage 2 when it is 30 to 40, and when it is when the body mass index is above 40, that particular person is in the grade 3. So we have different stages: grade 1, grade 2, grade 3, and the normal range is, normal value for the body mass index is, it should be less than 25. So that's about the body mass index. So here obesity is because of defect in the neuropeptide Y. Neuropeptide Y, a hypothalamic hormone secreted by the hypothalamus. So this neuropeptide Y increases the appetite towards the carbohydrate diet, right? So that particular, whenever it is more, so the person likes to eat more amount of carbohydrates, and the neuropeptide Y activity is regulated by the leptin. So that leptin is secreted by the adipocytes. So whenever leptin loses control over the neuropeptide Y, he takes excess amount of calories. Those calories, they are converted into fat and stored in the bodies. So there is excess accumulation of fat in the body. So that results in the obesity. So what are the complications of obesity? What happens in obesity? Obesity may result from, so why obesity occurs? Because of excess amount of calorie intake. So apart from that, we have other reasons like hypothyroidism, hypopituitarism, Cushing syndrome, and hypogonadism. So all those result in obesity, right? And what happens in case of obesity? What happens to glucose tolerance? Glucose tolerance is decreased in case of obesity, and also there is increased risk of coronary heart diseases seen in case of obesity, and there is insulin resistance. So these are the important complications of obesity, major ill effects of the obesity, and in addition to these three, that is insulin resistance, decreased glucose tolerance, and increased risk of coronary heart diseases, and there is increased lipid levels in the blood, so that is hyperlipidemia is also seen. So what is the treatment for this obesity? So uh, there should be calorie restrictions. So you have to take less amount of calories in the diet, and there should be physical activity. So by these two things we can treat this obesity, right? And coming to glycemic index, so when you take a carbohydrate, whether it is complex or simple carbohydrate, it affects the blood glucose levels, right? And this glycemic index is calculated by using a formula: area under the GTT curve after 50 grams of test meal by area under the GTT curve after 50 grams of reference meal into 100. So this gives the glycemic index. So glycemic index is basically, so when you take a food substance that affects the blood glucose level. So when you take complex carbohydrates, they release glucose slowly into the bloodstream when compared to the simpler carbohydrates, right? For example, when you take potato chips, their glycemic index is 80 to 90, and when you compare with that of ice cream, it has 35 to 40. So when the carbohydrates are taken with fats and proteins, the effect of those carbohydrates on the blood glucose level is low when compared to the potato chips, whose glycemic index is more. So we have to prefer food sources which have low glycemic index. So that won't increase the blood glucose level rapidly. Right. So we have discussed about how calories can be calculated by using the basal metabolic rate, specific dynamic action, and considering the physical activity. So after that, we discussed about the protein energy malnutritions, significance of carbohydrates, proteins, lipids in the diet, and what are the nutritional disorders, obesity, what are the reason behind that obesity, and what is glycemic index.